Hello, I'm Joel Lim. I'm the medical director at Gerber Nestle Infant Nutrition, and I have here today Dr. Jose Saavedra, who is an associate professor of pediatrics at Johns Hopkins University School of Medicine. The topic for today is the infant microbiome and the risks of dysbiosis. So my first question to Dr. Saavedra is, we've learned that a healthy microbiota is important for health. What constitutes a healthy microbiota?
Well, thank you for having me, Joel. Well, as I think we've all learned, there's been an explosion of interest in understanding and characterizing what the infant microbiota, and particularly the infant gut microbiota, is and how it's composed. And as most of us know, it's a very complex ecosystem with trillions of microbes, mostly bacteria. Interestingly, the human microbiota is composed mainly of 4 individual phylum: firmicutes, bacteroides, actinobacteria, and proteobacteria. And out of the 35 plus phylum that exist in biology, 4 explain more than 99 or constitute more than 99% of the human microbiota. And very interestingly, there's specific types of phylum and genus of bacteria that we've kind of co-evolved. For example, most human healthy infants will have a predominance of some specific bacteria. And by far, bifidobacteria seem to be the most predominant genus of bacteria. They belong to the phylum Actinobacteria. Similarly, increased amounts of lactobacilli, and on the other hand, have a very decreased amount of proteobacteria, where most of the pathogens like Salmonella, Shigella, and E. coli are. And this general profile, with very distinct variation, of course, both from population to population and individual to individual, but in general, it seems to describe what happens with most healthy infants. And deviations from that tend to cause some significant problems.
Recently there's been an increased incidence of dysbiosis. What are the risks associated with dysbiosis?
Yes, this term dysbiosis has gained a lot of popularity. It's a very generic term, but for the most part, it tends to describe these alterations in what would be the microbiota of an otherwise healthy baby who's born from a healthy mom, born vaginally, and who's breastfed. Most of these babies, as we discussed before, will have this general profile with a predominance of bifidobacteria and a decrease in pathogens and proteobacteria. And the main factors that determine what that profile looks like include, things like the maternal microbiota, what the microbes of the mom are, how the baby is born, if the mom gets antibiotics perinatally, or if the baby gets antibiotics in their first years of life. How a baby's fed. Of course, the food for a baby is also the food for its bacteria, and breastfeeding versus formula feeding, and of course, how a baby's weaned, all determine the profile of the microbes in the gut. And finally, of course, the environment plays a big role. If a baby is born in the hospital versus baby born at home, in an urban area versus a rural area, all those factors will modulate the bacteria, and in some cases lead to these deviations with decreased amount of bifidobacteria, decreased amounts of lactobacilli, and increased amounts of proteobacteria, including Clostridia and some Bacteroides. This is what we call dysbiosis. And very interestingly, dysbiosis has increasingly been associated with a number of health-related conditions, anywhere from infections, all the way to more chronic conditions in later life.
To follow that question about dysbiosis, how does cesarean section and formula feeding lead to dysbiosis?
Yeah, I mean, as we mentioned before, C-section and breastfeeding, amongst the many factors that can influence the development of the microbiota of a baby, those two are probably the most significant in terms of how drastically they can determine what the profile of bacteria look like in a baby. We've known for a very long time that not breastfeeding and in getting an adequate infant formula can lead to a number of conditions or increase the risk of a number of conditions, anywhere from infectious diseases like acute diarrhea, respiratory infections, otitis media, all the way to inflammatory conditions. And that includes things like allergy, anywhere from asthma to atopic dermatitis, and food allergies. And most recently, we've recognized the fact that it can lead to a number of chronic conditions. And those include inflammatory conditions like colitis and Crohn's and inflammatory bowel diseases, and even the development of celiac disease, if you have the right genetic background, all the way to increased risks of obesity, type 2 diabetes. So we have known that for a long time. What is very interesting is that over the last few years, we've also recognized that how you are born, in other words, the risk associated with C-section compared to babies born vaginally increases the same risks. Babies born by C-section, in very large studies now, it's clear, will also increase the risk of acute conditions like acute diarrhea, increase the hospitalization, the severity of diarrhea in the first 2 years of life, even in developed countries. Also, birth by C-section will increase risk of type 2 diabetes, overweight, and obesity. And we've also learned now, both with large epidemiologic studies and cohort studies, birth by C-section per se is an individual risk factor for increased risk of Crohn's disease, inflammatory bowel disease of other types, celiac disease, and interestingly, just like we learned in the last few years that breastfeeding can protect from leukemia, similarly, babies born by C-section will have also an increased risk of acute leukemia. In other words, there's a common denominator to these two risk factors for acute and chronic conditions in later life. And that seems to be this early shaping of the microbiota. Dysbiosis seems to be a common denominator for a number of these health conditions, both in early life as well as in later life.
I'm sure now everyone is asking, how can we mitigate dysbiosis associated with cesarean section and lack of breastfeeding? I think that's one of the big questions that I personally have.
Yeah, and I think that, you know, from the point of understanding this, the logical question is, how can we change this imbalance in the microbiota? I will say, first of all, that for the most part, you know, once a microbiota is established, it's very resilient. It's relatively stable. It can be altered, and certainly acute conditions can definitely do that. But it tends to come back to what an infant's early microbiota is, and then what a child's and later in an adult, their particular profile seems to be relatively stable. However, I think it's become increasingly clear also that there are interventions that can change some of these risks. And by far, you know, the two most significant ones have to do with those factors that shape or modulate the composition of the microbiota. One of them, and probably the best studied so far, is the use of probiotics. That basically means introducing into the microbiota a particular genus or species of bacteria that we know may be beneficial. And for obvious and logical reasons, then the use of both bifidobacteria and lactobacilli seem to be one of those mechanisms by which we can ameliorate those potential risks associated with dysbiosis. And specific bifidobacteria like Bifidobacterium lactis, Bifidobacterium infantis, and some lactobacilli, Lactobacillus rhamnosus, Lactobacillus reuteri, can and have been shown to decrease some of the risks associated with dysbiosis, particularly as it relates to acute diarrhea, acute changes in GI function, including the potential benefit in functional gastrointestinal disorders. And just to finish, and more recently, the introduction of human milk oligosaccharides, which are the food for specific bacteria, and particularly bifidobacteria in early life, may also play a role, since we know breastfed babies have the benefit of HMOs, or human milk oligosaccharides, while breastfed babies, non-breastfed babies do not.
Well, thank you very much, Dr. Saavedra. Those were really, very interesting, and of course, I'm sure the audience will learn a lot from this short interview. Thank you again.
Thank you. My pleasure.